This is Unit 6 revision video for biology, looking at the transmission of disease. First of all, we're going to look at the different ways that pathogens can get into your body. So here we've got entry via the mouth, the nose, the skin and the GU tract. Microbes that enter via the mouth can cause infection within the digestive system. If microbes manage to get into your body via the mouth, then they will move their way down into the stomach. The stomach contains stomach acid, which if any pathogens manage to get through to this point, it will do its best to kill those pathogens. Now this isn't always the case, but this is a barrier that the body has to prevent that. Another way that pathogens can enter your body is via your mouth and your nose. Now this time, instead of going down into the digestive system, they can end up in the lungs. Now the body does not want this to happen. The body wants to stay safe, so it has features that allow it to protect itself from these pathogens. So in the airwaves it produces mucus. Now this mucus will stick dust and pathogens to it, and then cilia, little hairs, will waft up the mucus up into your throat. So at this point, the mucus can either be ejected from the body or it can be swallowed, and we will get them killed in the stomach acid. Some pathogens that are airborne, such as cold viruses, can get past the cilia, and things like smoking can stop the cilia from working. This will reduce the effectiveness of this barrier and make the individual more prone to getting diseases of the respiratory system. The skin is really important because it acts as a physical barrier to microbes to prevent them from entering the body. Washing after having a cut will reduce greatly the number of microbes that are around that affected area. And to prevent microbes getting in further, the body produces a blood clot to form a scab and seal the skin. Now this is not the only way that microbes can get through the skin. They can also get in by insect bites that will penetrate the skin and allow microbes to get in. Also by infected needles that can carry microbes through the skin, such as HIV and hepatitis C. Now the last part that we're going to look at where microbes can enter the body is the GU tract. Now the GU tract stands for genitourinary tract, and this includes the reproductive organs and the urethra up into the bladder and the kidneys. So the body produces acidic urine, and this will kill any microbes that try and get into the bladder. Now this means that the urine is really quite sterile. However, some microbes are resistant to this acid and can overcome that as a barrier and cause an infection in this area. And when it comes to the genitals, microbes are passed from one person to another via sexual contact. Now this can be reduced by using barrier methods of contraception, such as a condom. So unfortunately, on the news we will tend to hear about natural disasters such as earthquakes, volcanic eruptions, tsunamis occurring around the world. Now on top of being a disaster in themselves, where we get destruction of buildings and death, there also are other risks involved. These occurrences can result in diseases being spread a lot more easily. Now, we're going to have a look at why this is and how these risks can be minimised. So there are various ways that microbes or pathogens can be spread to be able to enter your body. One of the ways is via contaminated food. So examples are things like Salmonella and E. coli, and these will grow where food is not prepared very well, where there's poor food hygiene standards. If these bacteria manage to get into your body via contaminated food, then they can overcome your body's defences and go on to cause food poisoning. Bacteria such as Vibrio cholerae are ingested from the body via the digestive system. When it leaves the body, if it enters water, it can contaminate it, and we will get lots of Vibrio cholerae bacteria within that contaminated water. Now, this contaminated water, if ingested, can go on to cause the disease cholera. This bacteria will cause an infection that produces a very watery diarrhoea. This diarrhoea has a white cloudy appearance similar to the water that's drained off following boiling rice, hence why it's called a rice water stool. Now, due to the very watery diarrhoea, it causes very quick dehydration of the patient who is suffering from this disease. In order to treat this disease, the patient will be given antibiotics to shorten the length of the infection, and also be given oral rehydration, including water and electrolytes, in order to rehydrate the body. Now, this disease is more common in developing countries, as developed countries tend to have better sewage disposal, so that this isn't as big an issue. Now, athlete's foot is caused not by a bacteria but by a fungus. Now, this fungus is called trichophyton. This infection is spread via contact. So, for example, if a person who is suffering from this infection walks through a swimming pool, if someone else walks over the floor where they have walked, they could pick up that infection through the skin. As shown in this picture, we can see that it causes a really red, inflamed, flaky skin. This infection can be treated with antifungals, which are put on topically, which means on top of the skin. And these tend to be in the form of sprays, creams and powders. Now, influenza, or flu as it's more commonly known, is transmitted via the air. This happens when a person sneezes, the virus particles are released into the air and become airborne. Once these virus particles are breathed in by another person, then that virus can then use it as a host for its replication and produce more virus particles for that life cycle to continue. Now, this infection can cause symptoms such as muscle aches, headaches, fever, diarrhoea, fatigue, and sometimes in the elderly and the very young, and in extreme cases in adulthood, this can result in death. There's not very much you can do in terms of treating flu. Each year you can have a flu jab which will inoculate you with the most anticipated strains of virus for that year. However, treatment tends to consist of dealing with the symptoms, so taking paracetamol and rest. An event such as an earthquake can cause a lot of damage. One of the things that we think straight away when you think of an earthquake is damaging buildings, but actually it can also damage sewage systems. So the sewage that would be taken away to sewage plants and would not have any effect on the general population is suddenly washed into drinking water and can contaminate, and we can get the spread of diseases such as cholera, which can travel and be transmitted via water. Electrical supplies can be damaged, so appliances such as fridges may not work, and then we will get food spoilage, so microbes will begin to decompose food. Now, this can be very dangerous because you can get food spoilage, which then can lead to contaminated food and food poisoning and infections via that route. This also kind of applies to energy supply disrupted. So we've got poor food hygiene due to maybe a lack of gas or electricity, where then food is not properly cooked. So microbes that could cause a disease are not being killed off via the cooking process. Medical supplies are destroyed during some natural disasters, and this can be an issue because if someone has an infection, especially if it's been made worse by damaged sewage systems and not being able to cook food properly, then the medical supplies are not going to be able to get to those people, so we've got a high risk of serious infection and even death. And again, this also highlights this difficulty in that if we've got damaged roads in an earthquake, for example, it's going to be really difficult to reach sick and injured people in these areas that have been affected. Also, in a lot of these circumstances, people tend to be crowded together and living in camps where they've lost their home, and in these crowded conditions, disease can spread really easily. Feel free to pause this video and have a go at this question. This ties together what we just looked at when it comes to natural disasters and the spread of disease.